Well, listen to this here. Drug overdoses in New Mexico cost more than 1,000 lives a year. The CDC says 75% of those included opioids like fentanyl. So I spoke with KOAT UNM health expert Dr. Ash earlier about what an overdose even looks like.
And the saying one pill can kill is true because people don't know how much fentanyl is in these pills. A single dose could be fatal. So if somebody is overdosing, there's a number of signs, including small pupils, limp body, shallow breathing, cool and clammy skin, falling asleep or not being able to wake somebody up. The more of these symptoms you see, the faster you need to call 911 and get medical help right away.
And the news has been full of stories about using naloxone to counteract overdoses. So what is it?
Naloxone is a medication that rapidly reverses the effects of opioid overdose and is the standard treatment for overdose. Over-the-counter Narcan comes in 4 milligram nasal sprays, and it's the first naloxone product approved for use without a prescription.
If it's available over the counter, who should have it?
First, anyone taking high-dose opioid medications prescribed by a doctor. High dose is considered anything equal to 50 morphine milligrams or more. Also, anyone who uses or knows someone who uses opioids and benzodiazepines together. And then finally, people who use illicit opioids like heroin or fentanyl pills. Healthcare professionals really want to destigmatize the conversation around naloxone. Even people who don't use drugs or opioids should have it on hand. You never know when you'll encounter someone in need of this life-saving medication.
All right. Thank you, Dr. Ash.